We're going to continue to talk a little bit more about patient access to information with a focus on immunization information. As a parent of two young children at back to school time, I have a personal stake in this in immunization information being more readily available, as I struggled the weekend before school started to make sure I had all of the information that the schools needed for my children to go back to school. So please join me in welcoming Rebecca Fish. Rebecca Fish is a senior policy advisor to the Deputy Assistant Secretary of Health and director of the National Vaccine Program Office, where she works on a number of vaccine issues, including the National Adult Immunization Plan, health IT, financing, and public health preparedness. She's a member of the Public Health Emergency Medical Countermeasures Enterprise Strategic Planning Team and BARDA Influenza Work Group. Prior to joining HHS, Rebecca worked as the global head of medical countermeasures at GlaxoSmithKline. Please join me in welcoming Rebecca Fish.
So thank you all. In my role at HHS, I work in the National Vaccine Program Office, and it's our job really to lead and coordinate federal immunization activity across many of the partner agencies. And one of the projects that we're really excited about is this collaboration that we have with ONC and CDC to increase consumer access to their immunization data. The idea here is really to provide a fast, simple, secure way for people to see their vaccine history or their family's vaccine history. It's about getting people the information that they want when they need it. I'm also the mother of 3 small children and have also gone through the process of enrolling my children in school, and that can be a very time-consuming process when you're trying to document that they're up to date and that you have all of their forms completed. Theoretically, this should help to improve that process. The physician enrolls in the program, then the parent enrolls in the program, which should take about 2 minutes, and then you can just log on and download an official record of your child's immunization, which would meet all requirements. But it's not just for schools. This is something that could be used for international travel. It's something that could be used for summer camps. It's something that you could use with an elderly parent to encourage your parent to have a better conversation with their healthcare provider. Really, this pilot project is just about simplicity and convenience. And there are a number of resources, I don't know how clearly you can see these, but that ONC and NVPO and CDC have developed to try to make people more aware of what this program is. Oh, sorry here. This is in pilot mode right now, so there are about 5 states participating. That includes Alaska, Washington, Arizona, Louisiana, and West Virginia. And one of the nice things from our point of view is that they're all implementing it differently. So we have some places that are working with pediatricians, some that are working with public health clinics, and some that are working with mobile immunization facilities. And from a federal perspective, that's very helpful because we're able to sort of see what's working, what's not working, and really how do we improve this project and make it better before we roll it out to a much broader audience. It's also worth noting that there are 2 elements of this pilot program. There's both the technical piece to really enable the data exchange, and then there's the sort of messaging or promotion piece to make sure that people are aware that this is a program that exists if it's something that is of interest or value to them. So this is one project, but I think my bigger message for you today is that from an immunization perspective, we see tremendous value in people being able to see and access their immunization data. When consumers have more information, they can make better decisions, and that's going to improve the quality of care. So from our office's perspective, we're really trying to connect the dots and make the system work more efficiently. One of the things that many of you may not be aware of is that every year 20,000 to 50,000 people still die of vaccine-preventable disease. That's more than AIDS, breast cancer, or car wrecks. And what's even more surprising is that 95% of those deaths are amongst adults. So we've made great strides in improving pediatric immunization rates, but adult immunization rates remain well below target levels. Our hope is that a project like this helps to close that gap. Maybe an adult logs on and looks at their vaccine history. Maybe they have a conversation with their physician. Maybe they choose to get a vaccine that they didn't know about or might not have gotten otherwise. So our goal here really is to try to move towards more seamless real-time data exchange via projects like this. Later this year, you're going to see the National Vaccine Program Office release the National Adult Immunization Plan, and a big emphasis of that plan is on health IT. It's on pilot projects like this, and it's about really trying to engage, empower consumers. So we would look forward to any feedback that any of you might have on that adult plan, and we hope that in the future to be bringing you many more pilot projects like this one. Thank you.
Thank you very much. That was a new statistic for me about the number of preventable deaths compared to that of breast cancer, AIDS, and the like. That's stark, and that's really surprising and important.